and we're looking forward to your presentation.
Thank you very much for the kind introduction and a very good afternoon to all. And I thank the LIT scientific team and my dear friend Sanjay Sud for giving me the opportunity to deliver a talk in front of you. So the topic, as was told, is will oral semaglutide be a game changer in obesity treatment and the personal experience. So here are my disclosures. A few slides in the presentation have been reproduced with permission of Novo Nordisk India, and these have been acknowledged in the slides with the company logo. I have not received any financial support from Novo Nordisk for this presentation. There is no other conflict of interest. So the flow of my talk will be as seen here. So the burden of obesity, as all of us know, in 2022, 1 in 8 people in the world were living with obesity. Worldwide, adult obesity has more than doubled since 1990, and adolescent obesity has quadrupled. In 2022, 2.5 billion adults, that is 18 years and older, were overweight. India, though as a nation, India's obesity is low compared to other countries. Its urban population is seen to be moderately high, too high, with around 20% of all men and more than 23% of all women are diagnosed as either overweight or obese. A Lancet study reveals alarming obesity rates in India, with 70% of urban population overweight, and India ranks third globally in obesity, following the United States and China. Approximately 80 million Indians are obese, with 10 million aged in the frame of 5 to 19 years. So, as is known to all of us, that the impact of weight loss on health outcomes is important, and it promotes the glycemic control, impacts the cardiometabolic risk factors, and disrupts the underlying pathophysiology, reverses or slows down the progression of the disease, and prevents the micro and macrovascular complications. So greater the weight loss, the greater is the improvement in all health and complications. If it is 5%, hypertension and hyperglycemia can be brought down. If it is between 5 to 10%, prevention of type 2 diabetes, metabolic associated fatty liver disease, PCOS and dyslipidemia can be controlled, prevented. If it is between 10 to 15%, cardiovascular disease, stress incontinence, steatohepatitis, obstructive sleep apnea, gastroesophageal reflux disease, and osteoarthritis of knees can be reduced or prevented. And if the weight loss is more than 15%, there could be remission of type 2 diabetes and reduction in cardiovascular mortality and heart failure with preserved ejection fraction. So the current FDA-approved anti-obesity medications are there on the screen. Out of these, 2 are available for use as an anti-obesity drug in our country, that's India. Orlistat had been there for quite some time, and very recently, a few months back, on 18th of July, tirzepatide was approved. Still, Novo has not been able to. Very soon it will get it registered by the Central Drug Standard Control Organization, that is the Indian drug authorities, for the use of injectable once weekly 2.4 milligrams semaglutide. Lilly has beaten them this time for this. So the medical rationale for oral semaglutide. Timely initiation of obesity treatment is needed to improve health and increase quality of life in people with obesity. GLP-1 receptor agonists provide effective weight reduction in people with obesity with a well-established safety profile. An oral GLP-1 receptor agonist for obesity treatment may lead to the initiation of GLP-1 RA treatment earlier in the continuum of the disease, because everybody wants to pop a pill. It's much easier, and they prefer that instead of injections. And oral GLP-1 receptor agonists may improve acceptance and adherence to some patients compared with injectable formulations. So the first oral GLP-1 RA for obesity treatment, oral semaglutide, it's a novel tablet developed for obesity management. the first GLP-1 RA in obesity for oral administration delivers a new possibility of obesity management and significant improvement to weight reduction with an established safety profile. Now let's see how does it work. So semaglutide is a human GLP-1 analog which has a 94% homology to the human GLP-1 and the half-life is quite long, approximately a week. And amino acid substitution at position A protects it against the DPP-4 degradation, and the amino acid substitution at position 34 prevents the C18 fatty diacid binding at the wrong site. So semaglutide mechanism of action, I believe everybody knows as it is, acting centrally. The absorption challenges of oral peptide-based drugs. This has been for all the oral peptides. So insulin also, it was difficult to get it as an oral formulation. So degradation in the stomach because of low pH and proteolytic enzymes, a limited permeability across the GI epithelium, and the GLP-1 receptor agonists administered alone have very low oral bioavailability. The bioavailability less than even 0.01%. So oral semaglutide is a novel GLP-1 analog which is co-formulated with SNAC. So enabling semaglutide absorption in the stomach. Specific dosing conditions have developed to optimize drug absorption. And based on the phase 2, the pharmacokinetic data, the drug has been developed. So this SNAC is a sodium N8 or 2-hydroxybenzoyl aminocaprylate. So why is oral semaglutide co-formulated with SNAC? Because the co-formulation of semaglutide with an absorption enhancer is necessary to achieve the adequate bioavailability of oral administration. The absorption enhancer SNAC is a small fatty acid derivative that promotes absorption across the gastric epithelium. Hence, oral semaglutide is co-formulated with SNAC. The absorption of oral sema occurs in the stomach, and absorption of semaglutide requires co-formulation, and it causes a local increase of pH leading to higher solubility and protection from proteolytic degradation. The transcellular absorption of semaglutide is strictly time, molecular size and concentration dependent and fully reversible. Approximately 1% of semaglutide is absorbed, the rest is degraded in the GI tract. So the earliest systemic absorption of oral semaglutide, estimated mean semaglutide plasma concentration time profile after a single dose of 10 mg oral semaglutide in healthy subjects is confirmed on the early systemic absorption. A complete tablet erosion occurs in the stomach. And the dosing instructions for oral semaglutide that it has to be taken first after getting up, so in the fasting state, and it has to be taken with a half a glass of water, approximately 120 ml. And one should wait for at least 30 minutes before eating or drinking or taking any other oral medications, and have your first meal and drink of the day and take any other medication you need only after 30 to 45 minutes. The factors decreasing semaglutide exposure is if you take food prior to the dosing. Increased water volume will also reduce its bioavailability, and decreased post-dosing fasting time. So semaglutide exposure is limited or absent in the fed state. As you can see here on the left, the 14 of 25 subjects in the fed arm had no detectable semaglutide exposure, whereas in the fasting, you can see the curves which are there, that the absorption is much higher. Lower plasma exposure with 240 ml of water. So why 120 ml or half a glass? Because it was studies were done where systemic absorption of oral semaglutide occurs early, independent of water volume, and slower rate of tablet erosion in the stomach as seen when administering the tablet with 50 ml versus 240 ml of water, and a delayed gastric emptying results in higher semaglutide plasma exposure. So recommended water volume for the administration of oral semaglutide is up to 120 ml. So clinically relevant exposure after administration is up to 120 ml of water in a fasting state, as you can see here. Then the other amount of water which is listed, so it's best with half a glass. And 30-minute post-dose fasting leads to clinically relevant oral semaglutide exposure. So these are some of the clinical trials, oral semaglutide clinical trials, their results translated to the real world settings. and which showed it was conducted in different countries, as it is available not here but it is available in a lot of other countries over the world. And the solid trial was from India, Ignite, Glimpses, and all these. So effective glycemic control with oral semaglutide showed a significant HbA1c reduction ranging from 0.9 to 2.03%. A real-world success of proven effectiveness in managing both glycemic control and weight in type 2 diabetes. And the remarkable weight loss. Oral semaglutide demonstrated significant weight reductions ranging from 3.4 to even 8.2 kilograms in this study. So oral semaglutide has established cardiovascular safety in type 2 diabetes. The Pioneer 6 results were there, and now a dedicated trial that was done in Seoul. I'll come to that. So cardiovascular safety was established. The oral semaglutide works beyond glycemic control because it improves the reducing the body weight, that helps, reduces the urine albumin creatinine ratio, and the UACR and the EGFR decline, and it's renoprotective. The FLOW trial can be extrapolated, though it was with the injectable formulation. It improves lipid profile, reduces the blood pressure, and reduces the inflammatory markers, CRP. So, if you see the practical consideration, a robust HbA1c reduction up to 2.6% from baseline for those who have HbA1c of 9 or more. Clinically relevant weight loss, 50% achieve 5 and 20% achieve 10% weight loss. First oral GLP-1 receptor agonist that providing the efficacy of a GLP-1 receptor agonist in an oral formulation, just popping a pill, no injections, no pricks, no needles. Proven cardiometabolic risk factor modification and cardiovascular safety, that is 21% reduction in the 3-point major adverse cardiovascular events. The cardiometabolic risk is targeted. No dose adjustment is required in renal and hepatic impairment. So whatever be the EGFR, if you don't have the background record of the person coming to you, the patient coming to you, you can start on. And no severe adverse drug reactions if it is given along with metformin or maybe just as a monotherapy. A low risk of hypoglycemia is there with this, and it should be taken, as was told, first in the morning on empty stomach with 120 ml of water, 30 minutes post-dose. Fasting should be maintained. And this is the SOUL trial. So this was a trial for cardiovascular safety and with oral semaglutide. The injectable ones were there with Pioneer, so this is with the oral one. And SOUL is a randomized, double-blind, placebo-controlled, dedicated cardiovascular outcome trial of oral semaglutide, the first oral GLP-1 in individuals with type 2 diabetes, and established atherosclerotic cardiovascular disease and with or without chronic kidney disease. And the data generated from this trial are expected to provide practicing clinicians with more information as to the optimal utilization of antihyperglycemic agents in type 2 diabetes in effort to reduce the risk of cardiovascular and kidney disease events. This has been published, and there has been found that 21% reduction in 3-point days. So now, coming to the oral semaglutide usage in India, the Indian Drug Authority, the CDA, approved the 3, 7, and 14 milligram formulations on the 27th of July 2022. Oral semaglutide is a pill form medication that is used to or is approved by the drug authorities in India to treat type 2 diabetes and improve glycemic control. It should be taken in addition to exercise and diet. The FDA approved oral semaglutide way back in September 2019, and the indications in usage is what I told. Now, semaglutide tablets 7 and 14 milligrams is indicated as an adjunct to diet and improve the glycemic control of type 2 diabetes. And very recently, that is since October this year, oral semaglutide has been approved by the Indian drug authorities as the first-line drug also with or even before metformin after lifestyle modification in the management of type 2 diabetes. Now, cost of oral semaglutide, if you see, one tablet of 14 milligram, 14, 7 and 3, all three are costing the same. And it's 325 rupees a tablet. So one tablet a day and a month's therapy costs about 90 pounds 90 sterling pounds. The cost of liraglutide, which is the injectable formulation daily of GLP-1, is about 122 pounds per month. This is what it costs in India. And the cost of dulaglutide, which is once weekly, it's about 92 pounds per month. So if you see, the cost is also nearly the same, if not less, if we consider, and you don't need to take a prick. So what will the patients prefer? So see the increasing number of patients who have been accepting or put on oral semaglutide in India. Once it was introduced, it was half the year had already gone before this drug came in 2022, and the number was little more than 60,000. And by the end of August, it is now 156,678 patients were recorded to be on this drug this year. Now, my personal experience with oral semaglutide. So, there are two small studies which I will tell you about. The first observational real-world study, it reveals the outcome of oral semaglutide when used in Indian people with type 2 diabetes, because all of these were people who were having diabetes, type 2 diabetes only, because it is approved not as a weight loss drug yet, and it is has to be given as a anti-hyperglycemic agent. So its impact on glycemic control and weight management. The study included 60 adult people with diabetes with a mean BMI of 34.1. 39 of them were females. From our center, the study was done, who were prescribed oral semaglutide 14 mg once daily. A mean age was 36.2 for males and 34.4 years for females. The mean duration of diabetes detection was 1.5 years. And the outcomes such as HbA1c reduction, weight loss, and side effects were monitored over a period of 1 year. All of them were followed up for 1 year, and the standards of care for glycemic management as per the ADA criteria were followed. That is antihypertensive medication or maybe some other oral hypoglycemic agents, statins, etc. All these were given along with lifestyle modification to all these patients. So the results showed a significant reduction in both blood sugar and weight loss. HbA1c, the mean reduction was 1.98%, and the weight loss mean was 15.9% by the end of the study. The side effects were mild and included nausea and anorexia for the initial 3 to 4 weeks of starting therapy. The adverse effects were well managed with supportive therapy without any dropouts. And the supportive therapy that I used was prescribing a PPI with a long-acting prokinetic like domperidone, fixed drug combinations of pantoprazole and domperidone is available. A previous night, post-dinner, I used to prescribe, ask the patients to take that drug, and the incidence of nausea was reduced very well. It could be controlled very well. Definitely for the first few weeks it was a problem, but proper patient counseling and education and help them out to overcome this. So oral semaglutide shows promising results in significantly improving glycemic control and reducing weight in the Indian people with diabetes, and its favorable safety profile and ease of use makes it a robust agent for the management of obesity and diabetes. And just 2 weeks ago, I presented this paper in the 52nd annual conference of the RSSDI, the Diabetic Forum in Delhi. And the second study is
I think we need to start wrapping up with that.
Yeah, sure.
Thank you.
So it's the second study is a small one, is to observe the real world setting where 3 males and 1 female patients, those who were already on injectable dulaglutide for at least 6 months, were switched over to oral semaglutide, once weekly dulaglutide to oral semaglutide 14 mg in people with diabetes, and no other changes in the standard of care was done, and they were followed up for 6 months. And after 6 months of treatment, it was seen with oral semaglutide that the patients demonstrated a sustained and further improvement in glycemic control, and mean baseline HbA1c of 7.8% reduced still further by 1.2, and weight loss by 8.6%. So this was a small real-world observational study. It showed that switching from once weekly injectable dulaglutide 1.5 to daily oral semaglutide 14 mg may also lead to additional benefits in glycemic control and weight loss for people with diabetes. Though switchover was well tolerated and promising, but it was a small one. Further larger studies are needed. And Yes, the conclusion is that oral semaglutide shows promising results in significantly improving the glycemic control and reducing body weight in people with diabetes, at least in India. Its favorable safety profile and ease of use makes it a robust agent for the management of obesity and diabetes, and it could pose a challenge to prospective candidates for bariatric surgery by at least delaying it, if not completely doing away with it. Thank you.